All right, albuterol, talking about the medication, some common trade names for it is Proventil and Ventolin, although it is very common to get it generic and just under the name albuterol. It is a sympathomimetic and it is a bronchodilator. If you remember back, it stimulates the sympathetic nervous system in a way. It is a beta-2 agonist, bronchodilation due to smooth muscle relaxation there in the bronchioles and bronchi. That's how it works. It is pregnancy class C. Some drug interactions that we need to keep in mind. It is synergistic with other sympathomimetics that you might be giving. If a patient is currently taking beta blockers, it may prevent a response and you might not get those bronchodilation effects that you're looking for. And then if a patient is on TCA, a certain TCA, then it may potentiate vascular dilation and kind of cause those to become worse, the vascular dilation. And it can also potentiate hypokalemia. It does cause a drop in potassium whenever you give it, just very small, but it could make it worse if a patient's already hypokalemic. Standard adult dosage is 2.5 milligrams. It's diluted in normal saline, then you put it in nebulized and give it in an oxygen mask with typically about 8 liters per minute of oxygen. It is pretty common to double that dose and give 5 milligrams at a time. On the pediatric side, 1.25 milligrams, again diluted in normal saline and then nebulized as well. The duration of effects for it starts working pretty quickly within just a couple minutes usually, and it lasts peak effects within 30 minutes to 2 hours. Usually it's faster than that, and it'll last for 3 to 4 hours at most usually. Some stuff we want to keep in mind when we give that: it can precipitate angina and dysrhythmias due to the beta stimulation. It can cause some tachycardia that we need to watch for, and if a patient's already got kind of a sick heart, then we might want to use some caution with that. And if a patient is prescribed albuterol at home and is already taking those breathing treatments, then we don't need to withhold that, and we can go ahead and give them another breathing treatment usually. And it works usually a little bit better because we are giving it with 100% O2 versus whatever they're doing at home. So that's just kind of quick and dirty on albuterol.